There are a lot of rumors around STIs and how someone can catch an STI, or a sexually transmitted infection. Today, we're going to do a little myth busting. Many people think that anal sex is a safe way to have sex, but it is very possible to catch STIs from anal sex. Any STI that's possible to catch from the penis or vagina is possible to catch in the anus as well. Some people engage in a type of sexual contact called tribbing or scissoring, which is the act of rubbing two vulvas or vaginas together. While this is a safer form of sex, there is still the chance of spreading STIs, specifically the ones that are spread from skin-to-skin contact. So herpes, HPV, and then there is a chance of spreading gonorrhea or chlamydia with tribbing as well. Thinking sharing drinks can spread an STI? No, this is false. By definition, a sexually transmitted infection requires sex for transmission, and sharing a drink with someone will not spread an STI. You may have heard that getting a wax can spread an STI. No. Most waxing facilities should follow very standard sanitation guidelines, but even the time period between one wax to the next will not allow survival of an STI on the materials. So no, you cannot get an STI from a wax. Think touching someone else's blood can give you an STI? This is a very specific situation, and most of the time, no. Touching someone else's blood will not transmit an STI. The only very particular situation where it can be transmitted is if you have an open cut that is not scabbed over and you touch someone else's blood. In those situations, it might be possible to spread HIV or hepatitis, but even that chance is very, very minimal. But generally speaking, no, touching someone else's blood will not spread an STI. A very popular myth is that STIs can be spread by sharing a toilet seat. This is false. It's just not possible for STIs to live on a toilet seat between use. No. I get asked a lot if using the same towel can spread STIs. No, it cannot. Again, the chance of an STI surviving on a material that is not someone else's body is non-existent. So no, you cannot get an STI from sharing a towel. Does kissing someone spread STIs? Technically, no. Kissing will not spread STIs. If you count herpes or HSV1 as an STI, it's possible to spread herpes with kissing, but no, other STIs are not spread by kissing. Does oral sex spread STIs? Yes, it's possible to spread STIs with oral sex. First, it's possible to spread an STI from the mouth to the private area. That's usually going to be herpes or herpes type 1. Other things that can be spread from the private area to the mouth include herpes type 2, HPV, and gonorrhea. Does condom use eliminate the chance of spreading an STI? Condoms are a great way to prevent spreading sexually transmitted infections like gonorrhea or chlamydia, but they're not 100% protection against spreading things like HPV, herpes, or pubic lice, or the things that you would consider skin-to-skin contact. So again, condoms are great for protection against spreading gonorrhea, chlamydia, trichomonas, HIV, syphilis, but not the skin-to-skin type of STIs. I get asked the question a lot, is it possible for two virgins to spread STIs? Technically speaking, no, it's not possible for two virgins to spread STIs. But the question arises, what do you define as sexual experience? And do you trust your partner? As we've addressed in some of these other myths, even having oral sex can spread the possibility of catching an STI. So if your partner has had oral sex, but not penetrative penis to vagina sex, it's still possible that they may have an STI. HPV is also a very prevalent STI that we really don't know a lot about and doesn't really show symptoms until much later in life. So whenever there's any question of sexual experience, talk with your partner very specifically, and that'll give the best answer to that question. A very common question is whether foreplay can spread STIs. It depends on the type of foreplay that you're engaging in. If it is rubbing genitals on each other, then yes, the chance of spreading STIs, especially the ones that are spread by skin-to-skin contact, is possible. If we're talking about hands foreplay, so fingering or rubbing someone else's clitoris, it's always a good idea to wash hands before and after foreplay, but the chance of spreading an STI by touching someone's private parts is non-existent. I hope you enjoyed this video. If you want to learn more about sexual health, subscribe to our channel. Thanks for watching.